now.
Hello, everybody.
Okay.
Thank you again for joining us. I am Eugene. We have Angela, creator, founder of Lady St. Lucia Lashes. I'm Eugene, does hair. And we have the doctor once again. And Dr. Assif, we're going to be talking about different, like the last phase of acne treatments. I'm
Yes.
just going to ask you right away. I've heard about micro needling. What is that?
Yes. First of all, let me start. Like this episode, mostly we're gonna be talking about acne scarring.
Okay.
So it is very, very important because you can prevent acne scarring. You can prevent from getting, because the time you have acne scars, it's becoming very, very difficult to treat. Just like we have to understand this. So before in the past, patient when they were in Accutane, which is we talked about before, which is like a vitamin A, isotretinoic acids, oral. A lot of laser we couldn't do, especially those ablative laser, which is we talk CO2, erbium ablative laser, which is we vaporize our skin. We took all your skin. The downtime is very aggressive treatment, very deep. So
Yes.
right now with the new technology we have, we can treat at the same time patients with Accutane, which is kind of very aggressive treatment. At the same time, we can treat them with other lasers. So
Wow.
since like you, Eugene, your question, microneedling, yes. Right now, we have what we call microneedling radio frequency. So in a way, you use a needle, which is kind of at the same time go to your dermis, but it gives you that radio frequency that heats, which is kills the bacteria at the same time build your own collagen. It's amazing treatment. So in a way, with radio frequency microneedling, we go deep to the dermis, usually go about 3.5 millimeters, very, very deep. And at the same time, we do radio frequency. That radio frequency, while you are in Accutane, it stimulates your skin, rejuvenates your skin. So those scarring doesn't happen. At the same time, it kills the bacteria. At the same time, it stimulates your collagen productions and avoid the scarring. And that's like you need about 4 treatments. So remember, we say before in the past, Accutane usually is by it's between treatment is between 6 and 12 months, depend how it is. But usually after 6 months, we lower the treatment. While we giving the treatment, we can use radio frequency microneedling. Amazing treatment. So reduce 80-90% of scarring. That is amazing. Which is no downtime, only one day downtime, only 1 day. So just you get like erythema and it's good. The other we can do, actually, like I said before, we can do fractional laser like CO2 and erbium laser. Before it was ablative. What is the difference? Because people, they're gonna ask me, what is the difference between ablative laser and fractional laser? Ablative laser, you ablate whole skin is gone. Fractional, just fraction of the skin. When you give the laser, you give it one part and you leave the skin around it, you don't touch it. It's fraction by fraction. So in a way, while other skin is like heavy laser, the skin around them is not. So it's less damage to the skin and less ablative, less aggressive. And you can do that to the patient while they are in Accutane. You can use fractional CO2 laser, which is CO2 is very, very aggressive. And also we can use erbium laser, fractional. Both of them are like the same, but it's not as aggressive as the ablative CO2 or ablative erbium laser. So again, before in the past, we couldn't do that. Before you were in Accutane, we couldn't do anything for you. We could not do any ablative laser. Right now, the good thing is, while you are in Accutane, we can use radio frequency laser, we can use fractional laser, CO2, which is like fractions. Like, we should probably, when we finish with with the acne, we should just probably have one for all kind of laser. Explain to people what's this, but it's very hard to kind of a little bit of explain everything at the same time. So that is what it's amazing, and you can prevent that. All kids, all teens are watching this. This is very important because it's better to prevent something than getting really deep scarring, and it gets very difficult to treat. So that's something about the laser. But also, like I said before there were debate before if you can do mechanical peel, acne peel when you Accutane. Right now, there is a lot of studies have shown that it's okay to do superficial peel, not deep one. But while you are on Accutane, you can also do some mechanical peel. That's very important. The other treatment for scarring also these days, you can use subcisions, which is basically you get in when you have that scarring, you can go under those acne and you create subdermal subcision of the subdermal. So because what happened, you just cut this those scarring under the skin, you just release those scars under the skin, because those scars under the skin, when there is it's basically that the one you need to get rid of. So we do needles, or sometimes we do just a toothpick, and we go under those scarring while they are fresh. Of course, I'm not talking about those scarrings that are old. I'm talking while you have this severe cystic necrosis of your acne, while they're getting skin, they're getting fresh, you go inside and you start releasing those.
I have a question.
Yeah, go ahead.
Doctor, when you say recent scarring, is that 1 month, 3 months, 6 months, or what is considered recent scars, and what is considered
while you are in treatment of Accutane? Yeah, of course, recent scar before they heal, or before you're talking about while they are active, while the acne is very active. It's not like after it's like 10 years after that you grow up and this you have those permanent scarring. So while the acne is active, or while you are in treatment, that is kind of a little bit of a time to kind of a little bit of I don't know if that's the time you can. Basically, I have my book in here. I don't know if you can see it or not, but it's as you see in here, there is the subcisions. Can you see it in there?
Yeah.
So you can go with that needle and you do those subcision under the skin. You see it in there?
Yeah.
Right over there. So basically, what you do, it's they call fanning. It's like you cut those. If you see, you numb the area and you cut. You see those fanning in there? You see those on here? Those stuff. You cut, because it's that one that causes those scarring under. And you go with the needle or toothpick and you just you do subcision over there. And be honest, it's amazing. It's amazing how to do it. And you could see in this picture over there the difference between this, like for example, this picture over here at the left in here. You see it in there?
Mm-hmm.
And you could see after.
Oh,
okay.
And is that after one session, doctor, or is that after multiple sessions? How many sessions are usually done for that?
Usually you do just one session.
Oh, wow.
And also when we do this subcision, we inject some steroids, anti-inflammatory things, and helps. And also when we do this subcision, also sometimes we can use fillers.
okay.
While we do this subcision, we can use also fillers. Fillers, what it does, gives you that volume, and it gives you a really nice shape of your scars over there. So it's really kind of a little bit of the other thing what we do for scarring, that it's kind of active. So let's say you have scarring and like old scarring and it heals. Sometimes we can do that toothpick and we can put some acids, just small, like not inside but over it, and we can get some acid over it, and it can heal up the scarring also. So my questions, all of this, what I want to try to do, there is a lot of things you can do for scarring these days. Any questions, Angela, for me? I talk too much. Go ahead.
No, you're doing great.
No, this is great.
Yeah, so managing, after the treatment for the scarring that you would perform, what is the best way for a patient to go home and actually maintain that treatment? So what is the best solution for them to prevent from their skin to go back? Like what's the best way to
Sure.
manage that?
So this is what it is. Definitely, when we talk, when you have a severe acne, we're talking about severe acne. We talk the people are watching us in here. We did like this our fourth one. That's right. We only did episode for acne. So I'm not gonna repeat myself. We went from mild acne to severe acne. Mild acne, you don't have to take Accutane.
Okay.
But if you have severe cystic acne, then that's where we start taking Accutane. Mm-hmm. And mostly the severe one is the one that's gonna give you the more scarring, because it's more severe. It's more gonna destroy your dermis and inflammation, and it's gonna so basically that is the most. So for Accutane, usually Accutane, it's really amazing medication for treatment. But what I say earlier, you can't do much. As long as you are in Accutane, you can do much. You're gonna follow up. But what you can do, you can follow up with cosmetic. That's the thing it can really help you avoid scarring, the one I talked earlier. Microneedling radiofrequency, fractional laser CO2, fractional laser, erbium laser. The subcision, I will tell you right now for scar subcisions, and also the reason like chemical peels, and TCA on the scars like that. Put it on the top of you just use a little bit of acids and you put it with toothpick and you just put it on the top of every scar. And what it does, that acids, it just burn and rejuvenate. Of course, you're not gonna pour acid. I'm talking about toothpick. You put it like in this, and you just up in the top, and that's used. So of course, it's gonna be in the hand of professional one. You can't do these things by yourself.
Right.
The other questions about the people will ask me, oh, I have roller at home. And can I do microneedling by myself? Roller, most of the roller is about 0.5 millimeters, so they are not going deep. Mm-hmm. So in microneedling, you have to go very deep to get the best results. But also when we do microneedling, also we do radiofrequency. It's not just go deep, but also that radiofrequency is like really remodel your skin, kills that heat, also kills the bacteria also.
Yeah, I remember actually going to your office for the first time, and Nada, your wife, did microneedling for me, and after even just the first treatment, I don't really have bad acne issues or anything like that, but I did I did have enlarged pores and uneven skin texture and stuff. And even after the first treatment, I saw a huge difference, and I started just kind of maintaining that. In that case, I think people are usually afraid of like what microneedling does, because in some videos that most people watch, there's a little bit of bleeding, from your face. And the thing is a lot of people don't know, like they actually like numb your face before you actually, get the treatment done. Sure. And there is bleeding, but the bleeding is a good thing because it's basically regenerating your skin.
That's right. And also, just everybody knows that bleeding is it's like you are just oozing a little bit. It's not
very mild. Yeah, you're not bleeding.
Very mild. You get red, and it's just basically just when after that, like it just like it become like red. You can work. It's just like one night. The next day you are good. Mm-hmm. But that bleeding is good. That means the treatment was very deep, was inside deep. And when you see that bleeding is good because you're stimulating your you're oxygenating your skin, vascularization of your skin. It's just like you have a soul and it's like a fertilizer, and you're making your skin works hard. It's like working hard. You cause these micro injuries, no one gonna repair your skin, which is kind of a little bit of microneedling radiofrequency. It's kind of a little bit of probably the most benign things. It's like, it's great. It's a great treatment, very benign. But also, like, I just had a few weeks ago before this, a girl that has scarring, just scars on her arm. She had the surgery and kind of scarring. And basically, be honest with you, the radio frequencies make a huge difference on her hands. It's like, just let you know, everybody can know. Right now, actually, in fact, when we talk about scarring, it's not just acne scarring. Even right now, we talk about even surgery scarring. So like even plastic surgery scarring. So before, in the past, it was a huge problem, scarring, because when people wanted to do scarring, they used to cut the skin and, you know, cut those scars and get. So right now, most of the scarring, basically, you know, even surgeons, when they do surgery, they recommend you like go for fractional CO2 laser, or erbium laser. They won't touch you. They won't just skin remodeling. Even I'm talking about real scarring from surgery. That's what we do these days. Even plastic surgeons, they say, oh, you have scars. They recommend you for go some kind of like this laser. Of course, when I talk about laser, you're gonna go to professional people.
Right.
You're gonna know what kind of energy you need, what kind of that. It doesn't mean that we have radio frequency, fractional CO2 laser. Okay, you can go to anybody. You have to choose because it's like we talked last time. Every skin type 1 and from skin type 1, we have 6 types of skin, very white into 6, and everybody has to have kind of energy. But if it's used at the good, and the good indication for its use, it gives you the best results.
Okay.
Now, doctor, I know people are going to want to hear this and they're going to want to reach out to you. Do they message you directly if they want to schedule a consultation? Are you doing consultations via Zoom right now? Or how are people able to sort of just get on the books?
I'll be honest with you, whatever they want, I can do it through a virtual, like just by phone, WhatsApp, FaceTime, Zoom, whatever they want.
Okay.
And be honest to do, anybody who is watching this and you want a consultation with me, it's great. But the one thing is, in anybody, don't let it go. It's better to get it sooner is better. That's what I can tell everybody. Do not like say, well, I have acne, I can do nothing about it. It's too late. Nothing is too late. You all the time, whenever you do it, it's better than leave it later on.
I think some people are also under the impression that if they have mild acne, and once it's cured or healed or treated, you're, like you said, like follow-up is necessary to prevent scarring and whatnot. But I think there's a lot of people out there who are under the impression that over time that's
it's gonna go away.
Yeah, it's gonna go away, or it's gonna disappear, or it'll, their skin texture changes, so it's gonna be less noticeable. What do you say to people with that kind of habit or mindset?
Okay, let me just a very good question, Angela. There is different type of people. There is some people, their immune system is not that great in fighting inflammation in their skin. So these kind of people, they are the one that develop scars.
Okay. So
there is some people genetically are good. They repair. They have very good immune system, and they kind of fight these inflammations. And after acne, their skin can look good after acne. Especially, I'm talking about mild acne. Most of the time, if you have severe acne, you may have some scarring. But again, remember, a lot of this scarring also genetics. Some of us, they have very good immune system, very, very good how to fight inflammations in your skin. So they fight it well, they regenerate their skin, and they may not have no residual, nothing, no scarring. Mm-hmm. Some people, they may have the same acne, but their skin is like, they don't have very good immune system to fight this inflammation, and they may get some scarring. Mm-hmm. What I would say is, if you have acne more than 2 years, and if you've been suffering from acne, it's not like kind of a little bit of, just go and check with your whoever is taking care of you, dermatologist or And cosmetic, like for me, for example, I do laser, I do cosmetic medicine, I do everything. Check with me, and I will check you out, and I will say, okay. Most of the time, people they will like say, okay, I'm having my family, my mom or my cousin, probably they have scarring. So we're gonna, if you are in your family, you see that people that scars badly, then probably you are the one that you want to seek, consultations or something like that. So to avoid it, there are some families, they have very good skin, they get that. But if you are a family that your cousins or something like that, and you see they have a bad scar, so you may, have a chance. If you don't seek help, you may have a chance to get scarring the more than the others. So again, it depends, but it's all the time. If you have an acne that lasts more than 2 years or bad acne, you all the time you want to check. When you are in treatment, you want to check, okay, well, I'm healing, but I'm not healing okay. Even your acne is great. Even your skin is great. It's when you get this treatment, you have nothing to lose. It's just gonna make you look bad, because all this treatment, what they do is just basically cause your skin rejuvenation, make your skin look good. You have bad skin or good skin, that treatment you have nothing to lose. But especially if you have family that you see acne scarring around your family, cousin like that, that's probably you may scar more than other people. It's the same thing when I go out, somebody's like, oh, I have diabetes, family, history of diabetes. Well, if you have a history of diabetes, your mom and your dad, then make sure when you go out, if you see everybody's eating sugar, make sure you're like, oh, I have my friend, they eat a lot of sugar. Yeah, probably your friend probably has a good genes, and he does not, doesn't have family of high blood pressure, doesn't have family. So what we talk most of the time, we are human beings made of DNA genes. Whatever your parents give you, you're not gonna avoid it.
Right.
So probably 10 years from now, we're gonna be making aliens, perfect gene. We're gonna pick, the guy like you're not gonna have a human being. We're gonna have aliens like perfect people. But so far, we get what we get from our parents. If your parents, they have family of coronary artery disease, you're gonna avoid it. If your family have this, you're gonna avoid it. So same thing for acne. If your family kind of get those scarring, you are the one who probably should seek help, so you don't get that scarring as that's my point.
Okay, that's actually interesting to know, because a lot of, like I said, and I've said this across a lot of points that you have brought out, as far as genetics go, that's not something that most people think, that it can be genetic. They just think that it's an individual problem. My mom's 65, and her wrinkles are barely starting to kick in, and I know she's a little bit worried about it, but I would be very lucky if I can go that long without getting completely wrinkled up and stuff. But
you're good. So if your mom is doing good, you're gonna be doing well. Just take care of yourself.
God, I hope so. I mean, I know that I have you, and thank God I have you. But
let me tell you, genes are first. Be honest, genetics are first. Then everything comes second.
Yeah, she's never had any kind of fillers or Botox or anything like that. So just the other day, she was kind of upset that she was starting to look and feel old, and I said, well, you're 65 years old and you've never had any kind of work done, so you're in good shape. But you just would never think that even scarring or just different attributes and conditions would be genetic. It's not a lot of things that like people instantly think about, like, oh, this runs in the family, so that's great information to know, that if you're prone to scarring because your family members scar very easily, or they have some sort of condition might run in the family, that's good to know, to know that it's not
sure. So just that Angela, you're right. But right now, be honest with you, like even families right now, like people look great at 65. Like let's see your mom, if she's doing all this, so probably at 65 she will look like a 55 or like 50 years old. So the thing is, even like you have a good genetics, like for example, when people come to my office, I tell them this. I tell them what we do, it's slow the process of aging. Of course, everybody's gonna age one time, but it's slow the process. Like for example, right now in our time, there's a lot of people in their 70s. They still look good.
Yeah.
Look at all our presidents right now, like Joe Biden, 78, and like I don't know, Trump, 73, 75. People are in their 70s right now. They're still working. Remember before, when you are 70, you are too old. Like, remember Reagan when he was going to be president, was 70, was like, was the oldest president ever to be a president. So around this time, what we're talking about, you can slow the process of aging. Even like, for example, before 65, they look very old. Right now, 65, he looks like just a regular person in the crowd, like, that. So what we do in here, even you have a good genes, like if your mom will get older at 65 or 70, so probably you won't get old till 80, 85, and that's not happening. So whatever you do to yourself, it will carry on. It will carry on for you. So, and you could see, like, for example, if you go like 60 years ago, like 1940s or something, 50s, people in their 60s are very old. So right now you see people in their 60s, be honest with you, you won't even see. I have clients come to me, they are 65. You have no idea they are 65. So all what we do, this technology out in there, it does help you keep you young. So just let you know, it is a lot of it out of there. And you see all the celebrities that out there, they look very young for their age.
Yeah, they look amazing. And I don't think, people are like, oh, they have, it plays in the fact that they have money to really take care of themselves.
Of course.
Things
Yeah,
like
of
that.
course.
But I think generally it's also, it's a misconception that it's partially not genetics. Like, there's people that spend a lot of money on how they look, and just genetically they just age the way that they age. And I feel like technology does a lot, but it can only do so much. Like, it can't really fight time, you know what I mean? So
well, yeah, you're right. Genetics are very important, but be honest with you, genetics also, without taking care of yourself,
right,
it won't help. You know what it is.
Absolutely.
So just saying, if you have the best genes, but you don't take care of yourself, it won't help you at all. It's just like the same thing. You are very smart. You inherit the high IQ from your parents, but if you're not working hard, if you don't do this, it's not going to help you. Your IQ. It's the same thing for genes. If you have good genes, but taking care of yourself, those genes. So, but my point is, both helps. Taking care of yourself with good genes, both of them help. Both of them equally help. Mm-hmm. That's my point.
I completely agree. Eugene, do you have any?
No, I was just like,
what are you gonna
this is a lot of information. I mean, it's great.
Yeah.
So now, what did you say we'll talk about on the next episode, Doctor? You said we'll do an episode just on lasers.
So laser, I wanna talk about different lasers, how they work.
Okay.
Because I feel a lot of people calling me to my office. They have no idea what is laser this, what is laser that, and I feel a lot of clients, they get cheated because some places they have only one laser, and they told me, what, this laser works for everything. This laser works for everything because they have one machine, and that machine they want to use it for every single treatment. In fact, every machine gets used for different purposes. There is no one machine treat everything else. And people, I want like kind of educate people about what this laser for, so at least if they know what this laser for and what this laser is for.
Okay, perfect.
Awesome.
Well, I think it's great, huh?
I think this is good. A good place for us to pause and then go into our information on our next episode, Doctor. Again, though, Dr. Assif, how can people contact you if they're interested in consultation for one of these services?
It's just they can call 949-466-3173.
And we'll have all the information on the YouTube video as well.
Yeah, 949-466-3173.
Perfect. Yeah, we'll include that in there as well.
Very good. Very good.
Okay.
Well, thank you, Doctor, again for doing this with us. Angela, thank you. And for everybody listening, share this, tag a friend that you think might be interested. We appreciate all the support you guys have given us so far. And until next time.
Okay, thank you.
See you guys later.